Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, there are some equations. The recommended equations for mainly estimation of glomerular filtration rate using the there are some recommended equations for estimation of glomerular filtration rate, which is using serum. For this equations, we have to use serum creatinine levels R. So we have two equations. So the equations for the estimation of GFR using serum creatinine are: one, we have equation from modification of diet in renal disease study. This includes GFR equals to 186.3 serum creatinine in milligram per deciliter to the power of minus 1.154 into age in years to the power of minus 0.203 into 0.72 if females, and we'll have to multiply all this with 1.21 if the patient is black or African ancestry. Similarly, we have CKD EPI equation. According to CKD EPI equation, we have GFR equals to 141 into minimum serum creatinine concentration by kappa into, so for all this is the serum chronic kidney disease EPI equation. Okay, now why are these equations significant? Actually, these equations are significant because the signs and symptoms of the chronic renal failure appear when the glomerular filtration rate is found to be less than 50%. When the glomerular filtration rate is found to be less than 50%, that is when you will see that the symptoms of chronic renal failure will occur.
thank you and thank you for watching.